our first leadoff hitter. I don't know if he's a who's the player from the Angels that I always talk about? Shohei. Okay. Anyway, but he's going to be our leadoff hitter, and he is Michael Osur, our past district governor, our past international director, and actually he was a past district director using the proper terminology. He is the assistant director for Riverside County Department of Public Health, where he leads a county COVID response operations of over 500 employees. He is well known in Toastmasters as a mentor, and since 2008, and has served on the Toastmasters International Board of Directors and led District 12 in Riverside, California International Recognition in 13 and 14. Our very special member, who is officially co-chair of this organization and also co-chair of District 100 Speakers Bureau, we are honored to have and hear from our own member, Michael Osur. Michael?
Tom, it's the first time you've ever read my intro almost the way I wanted it. So please. All right, I'm going to share my screen so I can do this talk. Thank you, everybody. Let's see if we can make this work. Can you see me? Can you see me? All right, you're all on mute.
Yes, we can.
So you nod your heads or something. Very good. Yeah.
Yes.
Welcome. Thank you for letting me come here today. Let me see if I can figure. Here we are. Here we are. So, COVID, what is going on these days with COVID? I want to give you some background. Half of you live in San Bernardino, half in Riverside, and a few in Azusa. Riverside County is 2.4 million people, the 4th largest county in California for square miles, the 10th largest in population in the United States. We're going to add 1 million people in the next 20 years. And it's a majority minority county, meaning we have more minorities than we do whites, which is unusual for many counties in the country. And we'll talk about that in a minute. If I can get my screen, here we go. So what are the demographics and why am I telling you this? You'll find out. So actually Riverside's 49% Latinx, 35% white, 6% Asian Pacific Islander, 6% African-American Black. A high poverty rate of over 20%, and 56% of the renters pay too much for rent, which is really sad. And unlike LA County, Orange County, San Diego, only 21% people have a bachelor's degree, and only 8% of Latinx have a bachelor's degree. And that sets the context. So for public health, pre-COVID, whenever that was, we had 650 staff and a budget of 100 million. Post-COVID, here we are, or during COVID, just for the vaccine response, we've added a $50 million to our budget and 600 staff. So imagine doubling the size of a large department and all this money to spend. Now I can spend money like nobody you know. So what are the, so here we are, here we are. So what's going on? Look at this graph. So you can see in the beginning, way back a year ago, a few COVID cases. Then in July, we thought the world had fallen up. Remember, we shut down everything. Look at that little blip there. So that basically lasted from July 4th till 3rd week of August. Then things got really good until Thanksgiving, Christmas. Look at that, how the cases went up. And it was terrible till the end of January, beginning of February. Cases dropped off, and now we're back to where it was a year ago. So there's my life. Every minute, you'll hear about first waves, second waves, third waves, fourth waves. There's really been two waves and maybe a third. Oop, here we go. So what's our status? Cases are going away. We heard, as you know, Riverside and San Bernardino both moved to the orange tier this week. Tom's happy. If you want to go wine tasting or beer tasting, you can do that now. However, we still have about 200 cases a day happening. And 10% of everyone who's positive goes in the hospital, and 10% of those people die. There it is. So we still have about 20 deaths a day. Most of those are from, it takes about a month to 6 weeks to die from COVID. I know, don't you love hearing me? But our focus has changed from disease management to vaccine, which is probably why you're all here today. And Mark's not, because he's dealing with his after effects of the second dose. So when I started this presentation Monday, you had to be 50 or older to get vaccinated. Of course, that all on Tuesday. The idea was, so health workers are sick people and people in skilled nursing facilities, let's do them. Then we said, well, old people are dying, getting sick. So they decided 65 was old. I'm 65. That's not old, but here we are. Hey, so we can get vaccinated, and I got vaccinated right away. Then they said, well, the food workers and ag workers, they need janitors and we need custodial. And then pretty soon, well, then there's people with underlying disease. Then you have to be 50. And this week, San Bernardino, Riverside, hey, if you're over 16, you can get vaccinated. Yay. That's everybody in this room, if you haven't been vaccinated. So we started doing vaccines on December 17th. Here we are, January, February, March, 3.5 months later, we've given over 1 million vaccines. And that's why you don't see me around. That's why I turn down every opportunity except Tom's to speak at Speakers Bureau. We have 230 providers helping us out, and almost 35% of the population in Riverside is now vaccinated, at least partially, which makes you like 95%. That's fabulous. I'm all so excited to hear this. And this is what I do every day, managing my team. Not enough, is it? So how many vaccines can we do a day? Well, we started out with none. Now we're averaging about 17,000 in the community a day. We need to do double this amount if we're going to reach herd immunity being about 75% of the population. And my goal is everyone vaccinated who wants to be vaccinated, needs to be vaccinated by Memorial Day.
The phone is acting up.
All right. Anyway, so everyone in this room, whatever I say, get vaccinated. So, but it's not equal around the population. White people get vaccinated at a high rate. NHPI is Native Hawaiian Pacific Islanders. The number, because they're such small numbers, it's a skewed number, so it's not quite as good as that looks. The Latinx, which you heard was over 45% of the population, look how they're only 18% versus 25% for white. Asian, because in the beginning we did healthcare workers, they had a high percentage. Black African American, 18%, and AINA, Alaskan, I think it's Alaskan Native, American Indian, or Native American, Alaskan, yeah, there you have it. But it's very unfair how we've done the vaccinations. As soon as we went to people 65 plus, it wipes out most of the minority groups, ethnic and race, and that's a problem. So we spend a lot of our time dealing with that issue because it's not fair. Everyone needs to get vaccinated, not just those who have cars and computers. So you can see here, look what happened when you go to 65-year-olds, right? It's easy to get vaccinated, but it's skewed toward white, and that's the problem. And because everyone needs to get vaccinated in the communities, not just a certain race group. Looking at this chart, the darker blue and the two darker blues, that's what's called the first quartile, the most disadvantaged. So those of you, I'm not going to go through a whole lecture. Quartile means quarters. Usually you think about equal quarters, that 25% of the population lives in each quartile. The fourth quartile are the rich. The first quartile are the ones that are the most disadvantaged. We've always been part of the group of Southern California public health departments that understood where the first quartile was. The state re-looked at this, and they basically, quartiles 1 and 2 in Riverside and in San Bernardino are part of the lowest quartile, which means those are the most disadvantaged. Coachella Valley, Desert Hot Springs, Hemet, and the area just outside Hemet. City of Harupa Valley, looking at the map. Those areas we focus on most because those are the most disadvantaged and also the least likely to get vaccinated. Now, this was our chart from a month ago of where we had our vaccine sites, our mass vaccination sites, which we did try to place in areas of disadvantage. The problem was when vaccine shots were hard to get, you had to go on your computer, make a reservation, and you had to have internet, you had to have a computer, you had to have a car, and that wiped out most of the disadvantaged groups. So we now have 8 mobile teams every day out in the community reaching those groups. They can do about 350 each day, multiply by 8. Karen will tell me how between 1,000 and 3,000. So no matter what we did, we realized groups that need to get vaccinated and the ones most disadvantaged are very hard to reach. And we have to figure out a way to do that. So we tried to go where those groups were. Now, I'm from the government. You should trust me, but no. So we've got contracted with 15 nonprofits. We call them CBOs, and they do the outreach. And then so that the government keeps a lower profile and just brings in the vaccinators. And that's been pretty successful. And we have done about, in those quartiles 1, 2, about 40%. We've really turned that curve around as much as we can, but it's been a challenge. And the other challenges are things you wouldn't expect. Well, here's my numbers. Whoop, there it went. And this is what I care about as public health, the least advantage, that you want to be, toward the redder, the top line there, the dotted line, and the least advantage will be the most advantage. You can see they reach it easily if you look at the dark blue. These are the charts I look at every day, and this is what we're trying to change. And again, remember the people that cook your food, serve you food, work in the hotels, the people you deal with every day and pay no attention to, I'm being facetious, those are the people that need to get vaccinated more than anybody. So one of the things I want to talk about, which in a different perspective, testing was the same thing. When people got sick, it wasn't equal across all race ethnicities. The poorer people got sicker and were in the hospital. Older people died because they were old. But now we're trying to do equity and vaccination, and that's really why you have us here, to make sure that everyone gets vaccinated, not just those with fast computers, cars. But like everything, and this is not to denigrate any elected officials or people who want to be elected officials, politics rears its ugly head. Racial minorities don't vote as much as white people. So it's a problem, or older people. And so the politicians like when we vaccinate people over 65 because they vote and they want to be reelected. Yet we have to make sure that everyone gets vaccinated. And so in the beginning, we had to fight that political battle to make sure that everyone should be vaccinated, not just the elderly. And then, of course, we say staffing. Where do you find 600 brand new people to work in your department? Where do you find 600 nurses to do vaccinations? Well, I'll tell you where we found them. The state hired a company that's based in Florida, and they brought in right now 400 nurses from the southeast, Georgia.
I will share that with you.
Arkansas, and luckily we pay a lot more here than they pay in those areas, and so they're willing to come and do all that work because there's not enough nurses at all in the Inland Empire of California to do all this work because they're all working their day jobs in the hospital. So that's been a challenge. So what do we do here? The environment changes every day. The rules change. The governor changes your quartile. We're now in orange. We were in red. We're trying to get to yellow. We're trying to make sure that people can get vaccinated. We had not enough vaccines. Now we have a lot, but people are worried. Is it safe? Is it not? Is it better to have 1 shot or 2 shots? And plus the TB, that people don't have other diseases, that kids get car seats. But there's opportunity for everybody here. Again, if we've hired 600 people to have jobs, that's better than them being unemployed. So, and making sure that whoever we hire reflects the diversity of the county. So I say to all of you, it's your turn. If you're over 16, you can get vaccinated. Both counties, Riverside and San Bernardino, have slots available. It's not like it was a month ago. Go online, sign up, get vaccinated, go back 3 or 4 weeks later, you're all set. People say, what's better? Is it better to be Moderna? Is it better to be Pfizer? Is it better Johnson & Johnson? The best vaccine is the one that you can get an appointment for, because even Johnson & Johnson, yes, it's about 70% after your shot, but you won't, the hospitalizations are almost zero, long-term effects, being really sick, zero. With Pfizer and Moderna, the first shot gives you about the same protection, and after 2 shots, you're 95 protected, but everyone gets to stay out of the hospital and get super sick. So that's really important. I didn't want to talk about variants, so I only have one line here. Every virus mutates, and this is mutating, but if we can get everyone vaccinated, it won't mutate because people won't be sick, and then we won't have to worry about it. But all the vaccines work moderately well against every variant. So even if you do get sick, it'll be much, much more mild. Still, no matter what, wear your mask, keep social distancing, meaning that's 6 feet. And of course, stay home when you're sick, because the governor and I both agree on this. Everyone needs to be wearing masks till we eradicate this like we. Where am I? There we are. Oh, and look how happy they are asking you to get vaccinated and make the world a better place. So, Tom, there you have it, my short, up-to-date discussion, and I'm happy to take questions if you want me to do that.
Yes, I think that would be really great. I'm sure that there are questions, and we're so privileged to have you as an active member of our Toastmasters to be able to get right straight from you the information that you can share with us. So go ahead and take some questions.
I have a question, Mike.
Oh, of course, Dr. Michael, you're wearing a mask. Thank you.
Yes, I thought you would appreciate that. I am wondering, I have a few friends, not a number of friends, a small number of friends, who are actually having problems with the fact that the Johnson & Johnson vaccine is derived from fetal cell lines. And I'm wondering if you have a concern about people not being willing to get the vaccines, or if that creates a problem, a bias, if you will, against certain groups.
Right. So this is a very good question, the Johnson & Johnson. Of course, it's the vaccine per se isn't derived from that, but the technology they use is from 20 or 25 years ago, where they did use aborted fetal cells. And it's hard to say, because who knows how other vaccines are made, but you're absolutely right. We contract with the Archdiocese of San Bernardino Riverside, and we're not allowed to use Johnson & Johnson in those areas. So there's still Pfizer and Moderna, but even the Pope said, take the vaccine that's available, because it's better to be vaccinated than not, because it'll save lives and help keep other people from getting sick. So, Michael, I don't know if that answers your question. It is a challenge, but we have twice as much of Moderna and Pfizer as we have.
I'm not, because I can't.
Randy Powell asking me a question.
Hey, Mike, how you doing? Can you hear me okay?
All right, Randy. Yep.
Okay. The question I have is, I got the Pfizer, and my question is, do we yet know, or do you have any idea when we'll know how long before we'll need a booster?
One thing I've learned, Randy, in the COVID thing is every prediction anyone made was wrong. But hypothetically, that is like the flu. Wouldn't that be great? And every year we just get a new shot and we do better. And I think we won't know for about 9 months to a year. And if we have to get another shot, it'll be just like the flu. And I think that's fine. And the next shot maybe will help with the variants, but maybe if everybody gets vaccinated, there won't be as many variants, and maybe we won't need it. But how about a year from now? That's my prediction.
Awesome. Thank you.
Michelle, you want to say
Michael.
something? Oh, Sunny.
Yes. So I was reading a news article that California is set to reopen completely on June 15. What do you think of that?
The governor wants to open June 15th. How do I say this? Medicine is political in California. Somebody in the governor's office is facing a recall, and he wants to make sure that it doesn't happen or that he gets reelected. Here's my goal. I want to get 75% of our county vaccinated by Memorial Day, in which case 2 weeks later will be June 15th. Maybe we'll be in good shape. It concerns me because one thing about COVID, every time you relax and take off your mask, you start infecting people. And we'll know, I'll tell you, we'll know in 2 weeks about spring break and what happened, Sunny. But also, I want to go drink. I don't want to I want to go visit without worrying about it. I want restaurants to be open. So how about that? It's wishful thinking. We thought it would take till July. Far be it for me to question the governor here. Teresa asked a question about someone who has extreme allergies. I have only one advice: talk to your personal physician and take their advice and let them decide, because I'm not a physician, obviously. And we take whatever your physician says, follow their direction, and bring an EpiPen with you if he says you should come, he or she says you should come to the site. And that's my best advice.
Michael?
Oh, Tom, you have a question? Oh, Michael has a question.
Michael, what do you think?
Michael Olson, you had a question?
Yeah, my question is, what do you think about the getting released to do international travel soon?
What about international travel? About getting tested before you go, or the vaccine passport, or what?
When do you think that we are going to be released that we can do international travel? It still seems to be locked down.
Oh, Europe. Well, I would recommend you don't go to England, UK, or Europe right now. They're having their fourth wave. You can't go to Australia without going to quarantine for 2 weeks. So, and you can fly to Canada. You can fly to. How far be it for me to say you shouldn't visit my friends in Cancun, but I wouldn't do it yet. Right now, Canada is probably like the U.S., but I think we're a ways off yet. And clearly, the board of directors for Toastmasters didn't want people doing it, so they canceled the convention in August. So I think that was a very wise move, Karen. Good job. So, Michael, I think we have to wait a few more months. All right. Anybody else? Esther, do you have a question for me? I know you were like all excited for me to present tonight.
No, great job.
Yeah, Michael, one
Right.
quick one. I don't know whether somebody else has questions, and this is so great to be able to hear your answers about the Johnson & Johnson, the one-shot routine. Is that being kind of nudged toward homeless, which are hard to get in for their second shot?
So we want to make sure we do about half the vaccine of Johnson & Johnson. We target for hard to reach groups, the homeless, people living in Blythe, if anyone's from Blythe, because it's hard to get out there, especially in the summer, groups that are hard to reach. And but we want to keep half of it for people that just want the shot for whatever reason. So we do a mix, and we mix it into all our regular sites that we call them super pods. Pods is points of distribution. In case you want to know what a pod is, that's what it stands for. So we were told that people wouldn't want it because it's not as good. Then we're told that everybody wants it. So it's just like everything else. It's a mix. Some people want it, some don't. We got 2 shipments of it in last week. So Riverside and San Bernardino both have a lot this week and next. But we're told that next week we won't have any. So I think it's one shot's good. The second, people end up in bed for 24 hours. You don't have that problem necessarily with the Johnson & Johnson. I don't see it as a problem because that means your immune system is revved up and you're all set to go. All right. I don't want to take up all the time because I can't wait to hear Melissa. I want to make sure we hear Melissa.
Okay. Well, thank you so much for coming here. We really appreciate your being here, and I'm looking at our attendance, which is a little better than it has been a couple of times. So you outdrew a couple of accredited speakers in the past, so that's pretty good. Or at least between the three of you, you did. Okay,